12 warning signs of pancreatic cancer. Every year, nearly 60,000 people in the United States alone are diagnosed with pancreatic cancer. What's even more alarming is that pancreatic cancer rarely shows any symptoms in its early stages, leaving many people unaware of its presence until it has reached an advanced stage. But why is this happening? Factors like smoking, obesity, and diabetes have been linked to an increased risk of developing this cancer, which makes understanding the warning signs critical. With the prevalence of pancreatic cancer on the rise, taking early precautions can be life-saving. This is where awareness becomes our greatest ally. Recognizing the signs can lead to early diagnosis and better treatment outcomes. In today's discussion, we'll discuss the 12 warning signs of pancreatic cancer. By staying informed and vigilant, we can take proactive steps toward better health and hopefully turn the tide against this formidable foe. So, let's get started on this important journey of awareness and education. Unexplained weight loss is often one of the first alarming signs of pancreatic cancer, and it's crucial to understand why this symptom occurs. Studies show that approximately 40% of patients diagnosed with pancreatic cancer report significant weight loss, sometimes as much as 10% of their body weight, even in the absence of dietary changes or increased physical activity. This can be particularly concerning because weight loss is not just a number on the scale. It can signal a deeper issue that deserves attention. So, why does this happen? The pancreas plays a vital role in digestion, producing enzymes that help break down food and absorb nutrients. When cancer develops in the pancreas, it can disrupt this process. Tumors can block the pancreatic ducts, preventing enzymes from reaching the intestines where they are needed. As a result, your body struggles to digest food properly, leading to malnutrition and unintended weight loss. Moreover, the body's metabolism can change in response to cancer. Cancer cells can release certain substances that alter the way your body uses energy, causing it to burn calories at a higher rate. This can leave you feeling more fatigued and unwell, further exacerbating weight loss. If we look at the statistics, pancreatic cancer is often diagnosed at an advanced stage, which can make symptoms like weight loss even more pronounced. The average survival rate is only about 10% over 5 years, highlighting the urgency of recognizing this symptom early. This is why being aware of any significant changes in your body, particularly unexplained weight loss, is crucial. If you notice that you're losing weight without trying, don't hesitate to seek medical advice. Abdominal pain is another critical warning sign of pancreatic cancer, and it's essential to understand its implications. Many people may experience discomfort in their abdomen from time to time, often dismissing it as something harmless like indigestion, bloating, or even stress. However, when this pain becomes persistent and severe, it can indicate a more serious issue that warrants immediate attention. The location of the pain can vary, but it often presents as discomfort in the upper abdomen or back. This can be particularly tricky because the pancreas sits deep in the abdominal cavity, making it difficult for individuals to pinpoint the exact source of their pain. As the tumor grows, it can press against surrounding organs and nerves, leading to discomfort that may radiate to the back. In fact, research indicates that about 70% of pancreatic cancer patients report experiencing abdominal pain at some stage of their illness, emphasizing its significance as a potential warning sign. Moreover, this abdominal pain can be persistent and may worsen over time. While occasional stomach aches are everyday and usually nothing to worry about, chronic pain that does not improve with over-the-counter medications or dietary changes is a different story. Interestingly, the type of pain associated with pancreatic cancer may differ from typical gastrointestinal discomfort. Patients often describe it as a dull, nagging ache that can come in waves. Sometimes it may also be accompanied by other symptoms, such as nausea, vomiting, or changes in appetite, which can further complicate the picture. Jaundice is a critical symptom, that can signal the presence of pancreatic cancer, and it's one that you should take seriously. This condition is characterized by a noticeable yellowing of the skin and the whites of the eyes. Jaundice occurs when there is a buildup of bilirubin, a yellow pigment produced during the breakdown of red blood cells in the bloodstream. Under normal circumstances, bilirubin is processed by the liver and excreted in bile, which helps in the digestion of fats. However, when a tumor in the pancreas grows, it can exert pressure on the bile duct, blocking the normal flow of bile and leading to the accumulation of bilirubin in the body. The significance of jaundice as a warning sign cannot be overstated. Approximately 50 to 70% of patients diagnosed with pancreatic cancer experience jaundice, often as one of the first symptoms. This is particularly alarming because, while jaundice can be associated with various liver and gallbladder conditions, its presence in conjunction with other symptoms should raise a red flag for pancreatic issues. When you notice a yellow tint to your skin or eyes, it's crucial to act quickly. While jaundice can sometimes be attributed to less severe conditions like hepatitis or gallstones, in the context of pancreatic cancer, it often indicates that the cancer has progressed enough to impact the bile duct. This blockage can lead to further complications, including liver damage, which makes it essential to seek medical help immediately. Additionally, jaundice may be accompanied by other symptoms, such as dark urine and light-colored stools. Dark urine occurs because the excess bilirubin is excreted through urine, while pale stools may result from a lack of bile reaching the intestines. If you observe any of these changes, it's a strong indication that your body is not functioning normally and needs attention. Nausea and vomiting are vital warning signs that shouldn't be overlooked, especially when they become persistent. Many of us experience occasional nausea due to various factors like stress, food poisoning, or even a typical stomach virus. However, if you find yourself feeling nauseous or frequently vomiting without any apparent reason, significantly if you haven't changed your diet, it could indicate a severe underlying issue, such as pancreatic cancer. As pancreatic cancer progresses, it can severely impact the normal functioning of your digestive system. The pancreas is crucial for digestion, as it produces enzymes that help break down fats, proteins, and carbohydrates in the food we eat. When a tumor develops in or around the pancreas, it can disrupt this essential function, leading to a cascade of digestive problems. Patients may find that they experience a constant feeling of nausea, which can be distressing and significantly affect their quality of life. Statistics show that nausea and vomiting can occur in about 30 to 40% of pancreatic cancer patients, particularly in the advanced stages of the disease. This symptom often arises when the tumor blocks the bile duct or presses against other parts of the gastrointestinal tract, preventing food from moving through the digestive system as it should. As a result, food may sit in the stomach longer, leading to feelings of fullness, discomfort, and nausea. It's also worth noting that nausea may not only stem from the physical blockage, but can also be a reaction to the body's response to cancer. The release of certain chemicals by tumor cells can affect the brain's vomiting center, contributing to these unpleasant symptoms. Additionally, side effects from treatments like chemotherapy can also lead to nausea, making it even more challenging for patients. Changes in appetite can be another significant warning sign of pancreatic cancer, and it's essential to pay attention to how your eating habits may shift over time. If you notice that you're losing interest in food, or that you feel full after eating only a tiny amount, it's worth investigating further. This symptom often reflects deeper issues within your body, particularly related to the function of the pancreas. The pancreas plays a crucial role in digestion and metabolism, producing not only digestive enzymes, but also hormones like insulin that help regulate hunger and blood sugar levels. When pancreatic cancer develops, it can disrupt these vital functions. Tumors may obstruct the normal flow of digestive juices, leading to malabsorption of nutrients, which can contribute to a reduced appetite. As the body struggles to digest food efficiently, you may find that meals become less enjoyable or that you simply don't feel hungry at all. Statistically, changes in appetite are reported by a significant number of pancreatic cancer patients. Research indicates that approximately 70% of individuals with this type of cancer experience some form of appetite change. This can lead to unintended weight loss and malnutrition, creating a cycle that can be difficult to break. When you're not eating well, your body lacks the energy it needs to function correctly, which can exacerbate feelings of fatigue and weakness. A sudden diagnosis of diabetes can be a critical warning sign of pancreatic cancer, mainly if you've previously been healthy. This connection is especially noteworthy because the pancreas is responsible for producing insulin, the hormone that regulates blood sugar levels. When pancreatic cancer develops, it can impair the pancreas's ability to produce insulin, leading to a disruption in blood sugar control. This condition is sometimes referred to as new-onset diabetes and can occur even in individuals who have no prior history of diabetes or risk factors. Research highlights a strong link between pancreatic cancer and diabetes. Studies suggest that around 80% of patients diagnosed with pancreatic cancer have some form of glucose intolerance or diabetes, particularly in the later stages of the disease. This is particularly concerning because, in many cases, diabetes is diagnosed shortly before the cancer is identified. It's thought that the cancer cells release certain substances that can interfere with insulin signaling, further complicating the body's metabolic processes. Unexplained fatigue is indeed a significant symptom that can accompany various health issues, including the onset of diabetes and cancer. When your body struggles to use glucose for energy due to insufficient insulin production, it can lead to feelings of extreme tiredness or lethargy. This chronic fatigue can significantly impact your daily activities, making even simple tasks feel overwhelming. If you find yourself feeling unusually drained and unable to shake off that exhaustion, it's crucial to consider what might be causing it. Fatigue is often described as a constant state of weariness that doesn't improve with rest, and it can serve as an important signal from your body that something is amiss. While everyone experiences tiredness from time to time, perhaps after a long day or due to stress, persistent fatigue is not something to ignore. In the context of pancreatic cancer, this symptom can arise as your body reallocates energy resources to combat the disease. Cancer cells require significant energy to grow and proliferate, and as your body fights back, it can leave you feeling drained. Research has shown that fatigue is one of the most common complaints among cancer patients, affecting up to 70% of individuals diagnosed with the disease at some point during their journey. This is not just a result of the cancer itself, but can also stem from treatments like chemotherapy or radiation, which can further deplete your energy levels. It's a cycle that can be particularly challenging, as fatigue can also exacerbate other symptoms, making it harder to maintain a routine. Changes in your stool can be a significant indicator of pancreatic health, and it's essential not to overlook them. If you start noticing pale, greasy stools that float, this could be a sign that your body is struggling to digest food properly, potentially due to issues related to the pancreas. Such changes can occur when the pancreas is unable to produce adequate digestive enzymes, which are crucial for breaking down fats, proteins, and carbohydrates in the foods we eat. Under normal circumstances, the pancreas secretes enzymes that help digest food as it passes through the intestines. However, when pancreatic cancer develops, it can disrupt this process. The tumor may obstruct the pancreatic ducts, preventing enzymes from reaching the intestines where they are needed for digestion. As a result, Undigested food, particularly fats, can lead to the production of stools that are pale, bulky, and greasy in appearance. This phenomenon is known as steatorrhea, and it occurs when there is an excess of fat in the stool due to malabsorption. Research indicates that up to 90% of individuals with pancreatic cancer may experience malabsorption as the disease progresses. This can lead to significant nutritional deficiencies and unintended weight loss, compounding the challenges associated with the disease. In addition to changes in stool color and texture, patients may also experience other digestive symptoms, such as bloating, gas, or diarrhea. Blood clots are another concerning sign that should not be overlooked, especially in the context of pancreatic cancer. The presence of tumors can trigger a cascade of changes in the body, one of which is an increased risk of developing blood clots, particularly in the legs. This condition, known as deep vein thrombosis, DVT, can manifest through symptoms such as swelling, pain, and redness in the affected leg. The relationship between pancreatic cancer and blood clots is rooted in the body's response to cancer. Tumors can produce substances that promote clot formation, disrupting the delicate balance of the blood coagulation system. Research indicates that patients with pancreatic cancer are at a significantly higher risk for thromboembolic events, with some studies suggesting that the incidence of venous thromboembolism in these patients can be as high as 20 to 30%. This risk can be even more pronounced in individuals undergoing specific cancer treatments, such as chemotherapy. Recognizing the signs of a potential blood clot is crucial. Swelling in one leg, mainly if it occurs suddenly and is accompanied by pain or tenderness, should prompt immediate medical attention. Redness or warmth in the affected area can also be indicative of a clot. These symptoms can be easily mistaken for a muscle strain or other minor injuries. Still, the potential consequences of untreated blood clots can be severe, including the risk of the clot dislodging and traveling to the lungs, leading to a potentially life-threatening condition known as a pulmonary embolism. Skin changes are another vital symptom to be mindful of, especially in the context of pancreatic cancer. If you start to experience a rash or persistent itchiness, these changes can indicate how your body is reacting to the presence of cancer. While many skin conditions are harmless and can arise from a variety of factors, unusual or persistent skin symptoms should never be ignored. The skin can serve as a window into your overall health, and cancer can manifest in various ways. In the case of pancreatic cancer, some patients may develop rashes, which can vary in appearance and may be accompanied by discomfort, itchiness, or even changes in pigmentation. The exact mechanisms behind these skin changes are not entirely understood, but it is believed that they may be related to the body's immune response or the release of certain substances by the tumor itself. Interestingly, studies have shown that around 15 to 20% of patients with pancreatic cancer report experiencing some form of skin change. These changes can also be related to jaundice, which may occur as a result of bile duct obstruction. When the bile duct is blocked, bilirubin can build up in the bloodstream, leading to yellowing of the skin and eyes. It can also cause irritation and itching. This can further complicate the skin symptoms and should be taken seriously. Abdominal swelling is a symptom that should never be overlooked, especially when it feels persistent or unusual. If you notice that your abdomen is swollen or distended, it could indicate fluid accumulation, a condition known as ascites. This symptom can be particularly relevant in the context of advanced pancreatic cancer and may warrant further investigation. Ascites occur when fluid builds up in the abdominal cavity, often due to various underlying health issues, including certain cancers. In the case of pancreatic cancer, the tumor can cause irritation or inflammation in the lining of the abdomen, leading to fluid leakage. Additionally, the cancer can affect the liver's ability to function correctly, which can further exacerbate fluid accumulation. Studies indicate that ascites can be present in approximately 15 to 20% of patients with advanced pancreatic cancer, and its presence often signifies a more progressed stage of the disease. The symptoms of ascites can be uncomfortable and may include a feeling of fullness, abdominal pain, or difficulty breathing due to pressure on the diaphragm. You might also notice that your clothes fit more snugly around your waist, or feel an unusual heaviness in your abdomen. While some people may attribute these sensations to dietary changes or weight gain, it's crucial to recognize when such changes are outside the norm. Indigestion or heartburn that becomes persistent and bothersome is a symptom that should definitely raise a red flag. Suppose you find yourself experiencing regular discomfort in your stomach, a feeling of fullness after eating only a tiny amount, or an increase in acid reflux. In that case, it might indicate that your pancreas is struggling to perform its essential functions. The pancreas plays a critical role in digestion by producing enzymes that help break down food. When pancreatic cancer develops, it can interfere with this process, leading to various digestive issues. As the tumor grows, it may exert pressure on the stomach and surrounding organs, causing discomfort and altering standard digestive patterns. This disruption can manifest as indigestion, bloating, or an uncomfortable feeling of fullness after eating. It's not uncommon for individuals to misinterpret these symptoms as typical digestive disturbances, but persistent issues warrant further exploration. Research shows that gastrointestinal symptoms, including indigestion and changes in appetite, are frequently reported by patients with pancreatic cancer. A significant number of individuals experience these symptoms even before a formal diagnosis is made. If your digestive discomfort is accompanied by other signs, such as unexplained weight loss, jaundice, or changes in stool, it's crucial to seek medical advice. In conclusion, staying alert to these 12 warning signs can be a game changer for your health. If you or someone close to you is experiencing any of these symptoms, don't wait. Reach out to a healthcare professional for a thorough evaluation. Remember, early detection can be a lifesaver when it comes to treatment and outcomes. Your health is your most precious asset, so stay informed, stay proactive, and take charge of your well-being. Thank you for watching, and take care of yourselves.